Hello, thank you for tuning in to the Path Nutritional Therapy, and my name is Brandy Lloyd. I am the owner and founder, and I'm just excited to be back on the podcast today, and I have some really neat things to talk to you all about. So thank you again for tuning in. Be sure, as always, to remember that this isn't any medical advice. These are just helpful tips and recommendation. This is for education and information only, and before you jump into anything, make sure that you talk to your doctor about it, your nutritionist, whoever you're working with. Something that I really notice with my own clients, and people ask me, well, why are your clients so successful? How come your clients are able to keep the weight off or improve their skin or get off medication? What is it that you do differently with your clients? So many of my clients, most are women between the ages of 45 and 65, and they're educated women, and they have seems like a lifetime of trial and error. Most of us didn't have many issues, thankfully, when we were in our 20s and early 30s, having children. We can kind of eat whatever we wanted. If we put on a couple pounds, we'd go jogging or cut back a little bit on some of the sweet treats, and we would find ourselves right back where we started before, say, a pregnancy. And we noticed how much that was, how different that was when we got into our mid to late 30s, and hormones are changing, lifestyle is changing. More women start drinking wine or more wine during that time frame. Anxiety, stress, lack of sleep come into play with the choice of kind of wanting a little bit of an evening sedative or something to kind of take them down from the rest of the day. And then, of course, the 40s hit and perimenopause, and now the diets and the choices that we made when we were in our late 20s, early 30s aren't exactly working. So by the time, and then we have a myriad of other health concerns now. Most of my clients come to me, they're taking, 1 to 5 different types of medications. They might be on hormone replacement therapy or long-term use of birth control in an effort to regulate their hormones. They've been working with their doctors on, resistant weight loss, meaning they just can't take the pounds off, whether they're working with, Weight Watchers or whatever kind of fad diet is around. They've been kicked around a little bit. They're not liking the labs that they see. Maybe cholesterol labs, maybe blood pressure labs. Their hormones. They're worried about thyroid issues. Most of their friends have been diagnosed with autoimmune conditions such as Hashimoto's thyroiditis. They're wondering if they fall into that category, or maybe they have nodules on their thyroid. It's just the hair loss, fatigue, headaches. They're kind of over it. They've been around the block with eating. They can no longer solve their own puzzle, and their doctors just keep giving them medication, proton pump inhibitors, like, for heartburn, stomach acid. They're taking sleeping pills, or taking anxiety pills. They're worried about genetics and their mom or dad's heart disease or cancer or variety of things. Most of all of them are on some form of antidepressant. It's just very frustrating. Most of my clients are very frustrated when they first come to me. And that's why I get the questions about, well, what did you do? What made a difference with you and how you work with your clients? And I can answer that fairly easily, believe it or not. Is being a functional nutritional therapy practitioner, I'm always looking for the root cause, and I'm always looking for ways to assist my client with the necessary lifestyle and behavior changes to move them towards their own personal goals. I call it bio-individuality. What does this one individual need? Where does she want to go? Where has she been? Has she had a lifetime of on and off since childhood of having to take antibiotics for maybe urinary tract infections, or does she get strep throat frequently, or, ear infections? Has she been a swimmer? Has she been an athlete? What kind of job does she work? So basically what I'm trying to say is, did she have C-sections? And, there are a lot of different factors. So basically what I'm trying to say is, this is a one-on-one opportunity. I'm not just putting all of my clients on some general program, much akin to when you walk into a gym and there's a bunch of just equipment or machinery on the floor. Just going through the 20 odd machines, person to person, everybody's going to have a little bit different results from doing that. And that's why, as also a personal and private trainer, I don't have a gym full of just machines that you just sit on and move the pin and find your doable weight and do that and go to the next one on the list. When I work with my clients on the mat, it's very individualized, very customizable. And I think that's a big struggle for the typical person, is trying to figure out, you're maybe listening to podcasts. Well, I know you are. If you're on mine, you're reading articles, you're following people like myself on Instagram or Facebook, and you're on health newsletters, and you're buying books, the Whole30 or the paleo approach, or whatever it is, and you're trying to apply these things to you. But unfortunately, even including my own podcast, it needs to be and must be fairly general. It's for the general population. And so it takes a professional, somebody with a little bit more knowledge or a lot of bit more knowledge, to take this general information and apply it to you as an individual. And without that piece of the puzzle, it can be very frustrating. So that's one thing that I do, is I help my clients through bio-individuality, customizing everything, getting a good sense of how they have lived and what they have been through, along with some other functional testing and evaluation. And I help them pare down what we need to put into practice. Truthfully, most of my clients or almost all of my clients are very educated in the latest health news. I have very few clients walk in the door that don't understand that low fat is not a healthy diet, and they're free to eat that coconut and the avocados and the red meat, and the saturated fat is not the demon. They come in with that knowledge. And they wonder, should they go gluten-free? Should they go dairy-free, soy-free? Should they try, paleo, like the grain-free nightshades, lectin-free, or the AIP approach? Or is ketogenic, a really low carbohydrate diet, going to be best for them? Or just a low carb diet? How do they figure out which one is best for them? And how long should they experiment with it? And how do they know if it's really working? Is it just the pounds on the scale? Is it just the hair loss? Is it energy? Is it sleep? Is it their skin, their digestive system? How do they know if they're choosing the right things, if they should stay the course? And what about when you hear people say sometimes it gets worse before it gets better? You're having a healing reaction. How do they know? And then combining supplements. They hear, well, get your B vitamins, or most Americans are low in vitamin D, and low or deficient vitamin D levels are closely associated and correlated. And they're looking at possibly being one of the causes for many different autoimmune diseases and conditions. And so should they just go out and take vitamin D? And which kind? And should it be paired with K2? What even is K2? Some of their friends take melatonin at night, or is that going to be good for them? Or they're hearing a lot of things about stomach acid. Should they start taking hydrochloric acid tablets? And there's all kinds of different ones. Some of them come with pepsin. Some of them are betaine. What does that even mean? And what are digestive enzymes? And they have questions about their gut flora, and they know they need to They know they need to work on balancing out their gut bacteria, the environment in their gut. Does that just mean they need to get on probiotics? If so, what kind? What about these spore-based probiotics that people are talking about now? And what about the Saccharomyces boulardii, the beneficial yeast and the lacto-fermented? And what about the different brands? And is Costco vitamins the same as Safeway, same as the health food store, the same as the vitamins they can get from a professional like myself, the professional grade? What do they really need to do? And so there's so many questions, and people are so sincere when they come in, and I think it's very frustrating when you sit at your doctor's office and you say you've been doing all of these things, and they're kind of glazed over and they're looking at you like, yeah, no, you just need to put the Krispy Kremes down. And you're like, that's not what I'm doing. I'm not eating like I did when I was 27 or 32. I cut down my wine. I feel like I'm barely eating anymore. And I've tried all these diets and it's just really not working. That's what I do for people, is I help put these pieces of information that they have learned. They've got all these puzzle pieces out on the table. We start to work it out so that we can actually see a personalized picture of what we need to do with their health. And it's not all at once. It is definitely better is better. It is getting them moving. It is getting them walking. It is getting them coming up with some habits in the evening, some bedtime rituals to help them sleep. It is starting from the very top with their eating and just cleaning some things out first, and then trial and error and looking at different things. Sure, I realize that I have more information about, say, like arthritis. If you have any chronic joint or tissue issues that are causing you pain, sure, I'm going to take away grain. I'm going to take away dairy. I'm probably going to take away nightshades, and we'll work those things back in to see, how you do with them. But there's a order to that. And there is practical ways to put this stuff into practice that aren't overwhelming, and they aren't stressful, and they aren't random. Our bodies are extremely complex, and I know that you know this. Hormones alone are crazy to learn about. The immune system, absolutely overwhelming. We're hearing and learning, and science is unveiling all of this amazing information about our guts, our gut brain access, our gut eye access, our gut skin access, our gut lung access, our gut emotional access. It's on and on and on, and the power that and the communication that our body has to keep itself going and balanced and working. And our power for our body once it's been broken and sick, our power that our body has to recalibrate and to heal and to repair is absolutely phenomenal. This is why I'm passionate about what I do, and that I just can't stop learning enough. But being able to put it all together is really difficult, and let alone how to apply it to you. So that's what I do with my clients, and that is why they achieve so many amazing results. I even see it in my own life and how that has been an evolution. When I first got sick, it was around 10 years ago. I didn't see a lot of the warning signs, the chronic fatigue, the extra fatigue, I would just call it back then, the tiredness, just kind of some of the brain fog and sleeping issues and whatever. I just figured I was so busy, and work is busy, family life was busy, I was getting older. This is just how it goes. I had a job that was real hard on my body, teaching lots and lots of group fitness classes, 23 a week. And I wasn't really noticing these things. And when it started hitting my digestive system, then I had to stop and take notice. Like, what's going on here? I'm having daily stomach aches after lunch that I can't even hardly get off the couch at 3:00 to go start picking up kids and then going to sporting events and practices and everything. And the daily headaches started getting worse and worse, a case of vertigo, my hair was falling out, different things that I had to say, okay, enough is enough. I needed to go to a outside party, because I basically had a personal trainer's basic nutrition courses for athletes and people who just were looking to lose 10 to 15 pounds, kind of nutrition training and education. And I had to move past that and went to my doctor, who has a very natural quality about how he deals with his patients. And we started going through some different testing, and he recommended a food elimination diet and taking some vitamin D, which we found out by labs I was really low. And so I didn't want to do the full food elimination diet, but I chose gluten, and instantly within 40